Thank you. Next presenter, AB 1118. AB 1118. AB 3183, please be ready.
The topic of my study is comparative pregnancy of 8shaped Sharsutra with a single loop Sharsutra in bilateral sinus treatment, a prospective study. Introduction, as all of you know about bilateral sinus, it's a recurring disease with a high prevalence rate in young carry males with high BMI and a deep nasal bag. The most common presentation of bilateral sinus is a discharging sinus in sacropoccygeal area in the midline nasal bag. However, extra-nasal sites can be there, like axilla, perineum, amputation stubs, umbilicus, air, or suprapubic region. Most commonly, intramuscular people who have prolonged sitting jobs, like IT professional, drivers, bankers. According to Ayurveda, it's known as Nadi Vrana. Nadi refers to a tract, and Vrana is an ulcer. Hence, the tract ulcer is called Nadi Vrana. Most commonly, it's called Shalin with the Nadi Vrana because of presence of foreign body in it. Sharsutra therapy is long known for effectively treating bilateral sinus. As standard Sharsutra offered 21 Bhavara, Pamarg, Snuhi, Haridra. That's a long known treatment for Sharsutra for this bilateral sinus. So, what's the purpose of this study? We have designed an 8-shaped Sharsutra ligation technique versus a single loop Sharsutra, which is conventional, and on the basis of outcome in terms of VAS score, time taken to cutting through the tract, and time span for complete healing. We are assessing on 3 parameters. Methods: 10 patients were selected from OPD of TMA at the Medical College Hospital. The tract length was approximately between 3 to 4 centimeters in all the patients. They were divided into 2 groups, n equal to 5, which I have mentioned as Group A and Group B. For Group A, 5 patients were selected, and for Group B, 5 patients were selected. Inclusion criteria is Pratyapan Lakshan of bilateral sinus, which is pain, itching, discharge, irrespective of gender. Recurrent bilateral sinus was also included in this study. Age group between 50 to 60 years, irrespective of gender. Exclusion criteria: carcinoma, malignancy, psoriasis, regression syndrome, hepatitis positive cases, HIV, and HIV positive cases were not included. Patients below 15 years of age and above 60 years of age were also excluded. Pregnancy, lactation was excluded. Sinus secondary causes like spine tumor or tuberculosis of spine. Patients with systemic diseases like uncontrolled diabetes, mellitus, hypertension, and infection of spine by herpes simplex virus. Patients with complicated fistula along with bilateral sinus were also excluded from the study. So both the groups received, as I told already, Sharsutra with 21 Bhavana made up of marks, Snuhi, and Haridra. The study evaluated 3 parameters, as already told: VAS score, time taken to cutting through the tract, and time span for complete healing. Efficacy was assessed from insertion to complete rounded. Operative procedures in Group A, normal operative procedure was adapted using a copper variable through the tract was poked, mouth was made open, and the excision of hair and other material that was inside the tract was done manually. Sharsutra was inserted in the tract with copper variable probe in 8 shape by making 2 openings, proximal and distal, to the main cyst. Actually, bilateral disease comprises of a cyst and a tract. So the cyst was the target. From cyst to proximal and distal, that distal opening was already there in some cases, but proximal opening was made artificially, like you can see in the pictures. And the Group B as a normal Group group B were subjected to a preoperative workup as usual. Mouth of the sinus was made wide open, and accession of air and other damaged material was pulled out manually, as done in the group A as well. The track was probed and Sharpshooter was inserted as a single loop side and tied outside, as you can see in the picture. Results. VAS score, not much difference. Both the groups had similar VAS scores because the pyramidal sinus is not that painful even after putting in a Sharpshooter. Average time to cut through the track was seen in 8-shaped Sharpshooter, it is 45 days, and in single loop Sharpshooter, it is 60 days. Average time taken for complete healing 60 days and 80 days. VAS score, as I told that, in this current study, it was observed that there is no significant difference in pain experienced by the patients during the course of treatment, and both groups received similar scores in this study. Time taken to cut through, there was a marked difference in time taken to cut through the pyramidal sinus tract in both groups. Although the length of the track in both groups was similar, as I already told, 3 to 4 cm approximately. Group A with 8-shaped ligation took around 45 days to cut through the track, and in group B it took around 60 days. Results for time taken for complete healing. Patients from group A took around 60 days for complete healing, that's 15 days after the cut through. And in group B, it took some extra time, 80 days for complete healing, 20 days after the cut through. You can see the complete healing pictures. Conclusion. Efficacy of Sharpshooter as a primary choice of treatment has been established by many research scholars. I don't want to do it again. But new modification techniques like 8-shaped insertion have some additional benefits. The technique comes with basic benefits of common single loop Sharpshooter with no complications, and with the features of quick cut through, robust disinfection, and quicker healing. Hence, it can be concluded that this minimal modification of Sharpshooter technique can be essentially have better results and reduce the time of treatment. These are some acknowledgements. Thank you.
Other than this cutting and healing time, is there any other benefit out of this?
That is the picture.
It can also be attacked through that single loop.
Yes, I understand it. But once you do, I can show you the picture. But you can see in the picture that the incision has been made on the cyst itself. So the thread crosses at the cyst and the knot of the thread is put inside the cyst. So the concentration of Shara in the cyst is more as compared to single Sharpshooter. This causes robust disinfection of the tract and quicker healing.
Okay, does it cause more scar mark?
Not much difference.
Compared to single loop?
Because this proximal opening is made just beyond that original cyst. Just half a centimeter beyond that cyst.
Okay. Then in your study it is told I have excluded the TB CA conditions. I have done all the tests for that. How did you exclude the study or diagnosed cases?
No cases only.
Only known cases.
We have done triple serology and normal surgical work only.
Okay, no, nothing.